Uh, Once we know that the nutrition is like very important, let us know how the brain develops during adolescence, ma'am.
So as we saw that like about 50% of the adult growth, that is the height and weight, is achieved during adolescent. At the same time, we also know that the brain, which is like around the size of like 200 grams in a newborn, achieves the maximum weight around 6 to 7 years. So the 90% of the brain weight is achieved by 6 to 7 years. But after this, like after 6 to 7 years and throughout the adolescent period, there are a lot of changes that takes place in the brain that attributes to the behavioral characteristics that we see in the adolescent. First of all, the parents should understand that the adolescent brain is like a site under construction. So it is still under construction, and it needs a lot of maturation to become the adult brain and to reason out between right and wrong. So this is the first thing that the parent should understand. So this understanding this and giving them a supportive role and helping them make a decision like right or wrong is the most essential thing that a parent should do. So we saw that this brain undergoes certain changes in the adolescent period. There is a lot of shedding of the gray matter, and there is an increase in the white matter. So the adolescent is always like trying to make a lot of doing a lot of things at one time. So the brain makes new connections every second, and this is very much active in the adolescent. So that is why they're able to do multiple things at one time. So for example, a parent might see an adolescent having a Walkman in his ears and reading a book, studying for the exam, at the same time watching a TV. So the brain is wired in such a way in adolescent is that even though watching a TV and listening to the song, still they can grasp the subject they read. So that is how the white matter in the brain is, the wiring is there in an adolescent brain. And two other important things that we need to know in an adolescent brain is that a small portion called the amygdala, which is the emotional center of the brain. It is very much active in an adolescent, and it is responsible for all the emotional outbursts, or today's parents always have conflict with their adolescents, the aggressive nature, the rebelliousness. So all these features are because of this overactive amygdala. And also the passion, like they don't know the risks associated with doing certain things. So the risk taking that we call the adolescent risk taking behavior is also more because of this overactive amygdala. And one more thing, we have the center in the front of the brain that is called the frontal cortex. It is a portion which undergoes maturation throughout the adolescent period and is finally mature only when any person like attains like 21 to 23 years. So till then, the frontal cortex is not mature, which means that the frontal cortex is akin to the decision-making capacity of any person. For example, it's like the CPU of a computer. So a person, if has to make a decision right or wrong, depends upon the frontal cortex. So we can see that an adolescent has an active amygdala, is always on the move, very energetic and risk-taking and rebellious. At the same time, the frontal cortex is not mature. So that explains the adolescent behavior of all these behavioral problems and the risk-taking behavior. So this scientific things are the that like the parent should understand these facts before approaching an adolescent.
Very beautifully explained, ma'am. The way now we understand the reason why the child is like could be rebellious, and later on, once they attain the age of 25 years or so, they become more mature, understanding towards the parents. It's always like we are standing on a double-edged sword with the child. I have my own teenage girls, like you said, they are with the earphones, they are with the laptop, they have a book around, they are writing notes. So this kind of multitasking that I have seen, most of the parents will definitely try to relate that they are able to do so many things. And I like one more point, what you said, the brain is under construction. So we know that they actually don't become fully mature till 25 years is what we say, 23 to 25. Nicely said. So that the parents understand the needs of the adolescents well, and we actually can talk to them in a different way because they are on the rise, they are on the go. So we tell them to calm down, and then we can talk to them in the tone that they can understand better. With all these things, the role of hormones also is equally important. Could you enlighten us on the role of the hormones?
Yeah, so there are many hormones that play a major role in the adolescent growth spurt and also the pubertal changes, the secondary sexual characters that we call. The male sex hormone is called the testosterone, and the females we have the estrogen and the progesterone. So these hormones are increased during the adolescent stage, which is influenced by hormones from the pituitary, so leading to the growth spurt. That is a normal thing that happens during the adolescent period. And this testosterone is also present in a small quantity in the girls. So this testosterone is responsible for all the aggressive behavior, the anger outbursts that happen in the adolescents, and it also leads to sexual feelings and attraction towards the opposite sex. So any parent should understand that any adolescent, whether it is a boy or a girl, it is natural to have an attraction towards the opposite sex. So we should not be very judgmental. So whenever they talk with the opposite sex, or in the school they go out and things like that, but the parent should also set some rules or boundaries. So these are certain things that the parent should follow from the early childhood, not only in the adolescent period, a bit starting from the early childhood. So setting boundaries and rules is very important. For example, if a boy or a girl is going to go out, so going for a party or going for a thing, so there are 4 questions that every parent should ask. So where are they going, with whom they are going, so what is the friend circles? Every parent should know the friend circle of their daughter or son. So with whom they are going, how are they going? So this travel, because nowadays substance abuse is very common in the adolescence, so starting from the smoking, alcohol. So we need to know whether our child is going safely with his friend who is not addicted to alcohol or smoking. So with whom, like what mode of transport, and what time are they going to get back? So these are the 4 questions that every parent should ask to their adolescent boy or girl when they ask you permission to go out. So instead of refusing them outright not to go out, and we can't do that because they will develop this rebellious character and try to do things hiding to us. So instead of doing that, setting clear boundaries and rules and guiding them will be a better approach. So, because these hormones are in play during the adolescence. And also in the girls, the estrogen and the progesterone are secreted, which leads to secondary sexual characters like development of the breast, pubic, and axillary hair, and things like that. And finally, it terminates in menarche. So every parent should have a chat or an open communication with their adolescent regarding this pubertal issues like menstruation. There are many, if they're not able to talk openly, there are many media like help, like gadgets. There's something called the menstrupedia.com, which is a
True.
YouTube video.
Yes,
It is
ma'am.
available in all the languages, which
Books
explains
are also
clearly.
available, ma'am.
Yeah,
Wikipedia.
correct. Which
Books are also
explains
available.
clearly about all the hormones, menstruation, the changes in the boys and changes in the girls. And also, we think that only the adolescent girl undergoes puberty and menarche, so there is no need to care about boys, which is totally wrong. Actually, the adolescent boy is the one that we need to concentrate more on, because they may not be aware of the changes, and they're mostly influenced by peers, and all the knowledge they get is from the media or other sources which may not be right. So, for example, if there is an adolescent boy, the father may try to communicate, or if the mother is comfortable talking with the boy, she can very well communicate with the boy about the changes, like the formation of the Adam's apple, which we say in the boys, which happens, and the height and the weight and the growth in the testicular volume and the penile length. And finally, they develop pubic and axillary hair. And we can also talk to them about nocturnal emissions and things like masturbation in the middle and late adolescence. So these are some open talk that we need to have with our adolescent children.
Okay, ma'am. Thank you so much. I would just like to give it a brief in Telugu for the parents who are listening here. కౌమార దశ, దట్ ఈస్ అడాలసెన్స్ అనేది కౌమార దశలో మేడం చాలా బాగా చెప్పారు ఏం చెయ్యాలి అన్నది. ఒక్కటి ఏం చెప్తానంటే పిల్లలు బయటికి వెళ్తున్నప్పుడు, ఫ్రెండ్స్ తో బయటికి వెళ్తున్నప్పుడు 4 ప్రశ్నలు మాత్రం మనం అడగాలి. ఎక్కడ వెళ్తున్నారు, వాళ్ళ ఫ్రెండ్స్ ఎవరు మనం తెలుసుకోవాలి. పేరెంట్స్ లాగా అది మన ఇంపార్టెంట్ ఒక రోల్. వాళ్ళ ఫ్రెండ్స్ ఎవరు, ఎలాంటి ఫ్రెండ్స్ తో వెళ్తున్నారు, అట్లీస్ట్ వాళ్ళ పేర్లు కానీ ఫోన్ నంబర్స్ కానీ మన దగ్గర పెట్టుకోవడము జాగ్రత్త పడడం అవుతుంది. ఎలా వెళ్తున్నారు అండ్ తిరిగి ఎలా వస్తారు ఇంటికి, ఈ 4 ప్రశ్నలు కనుక మనం అడిగితే పిల్లల సేఫ్టీ మనం చూసుకున్న వాళ్ళం అవుతాము. వాళ్ళని టోటల్ గా రెఫ్యూజ్ చేయకుండా వాళ్ళకి కావాల్సిన దగ్గర వెళ్ళనివ్వాలి, పర్మిషన్ ఇవ్వాలి, అండ్ ఏ టైంకి రిటర్న్ వస్తారు అన్నది కూడా మనం కనుక్కోవాలి. థ్యాంక్ యూ సో మచ్ మ్యామ్.
Yeah. So
మ్యామ్,
I can also understand some Telugu. If the parent asks, I can manage. I speak
మ్యామ్, దట్స్ సో
Wow,
నైస్.
wonderful,
Thank
wonderful,
you.
Lakshmi.
Thank you. We will move on to some puberty related specific questions now, ma'am. What is puberty and what are the triggers?
Okay, so first I need to talk about the timing of puberty. In recent times, we are seeing a lot of girls like attaining puberty or menarche a little early. So like 2-3 decades back, attaining menarche for the girls was common around 13 to 14 years, like when they were in the 8th standard or 9th standard. But nowadays we are seeing girls like attaining puberty a bit early, like even 9, 10, and sometimes even 8. So puberty, when it occurs in a girl before 8 years, it's called precocious puberty, which needs to be evaluated. So we need to see a pediatric endocrinologist doctor. At the same time, in the boys, if there are changes related to puberty, like increase in the testicular volume or the penile length before 9 years, then it is called precocious puberty. So these two things have to be evaluated by a proper pediatric endocrinologist. Otherwise, like after 8-9 years, it is normal to have puberty these days. For girls, the first sign of puberty is thelarchy, which is called the breast development. So the formation of the breast buds and then the areola and the nipple is the first sign of puberty, which is the secondary sexual character we call in an adolescent girl. The pelvis, and then we have the pubic axillary hair formation, and finally it culminates in menarche. And in the adolescent boys, the first thing will be the growth spurt. And as we said earlier, the growth spurt in the boys or the puberty changes takes place a little later than the girls, like 1 or 2 years later. For an average adolescent girl attains puberty like around 11 years. So it may be 12 or 13 in the boys. So if you see a class of boys and girls in around 6th or 7th standard, the girls used to be taller than the boys. But after like when they go to 9th, 10th standard, the boys' height is more, because the boys, though they start puberty late, the growth spurt can continue for a few years later, and their final height is also more than the girls. And then in boys, we form what we call the voice break. So that is one of the signs of puberty. And again, formation of pubic hair, axillary hair, and development growth in the testicular volume and the penile length. So in boys, if these changes are not taking place, for example, the testicular volume is not increasing, or there are not any visible changes, like even by 14 years, so then we call it as delayed puberty. So if these changes are not seen by 14 years, then again we need to approach an pediatric endocrinologist and evaluate the child. Similarly, in the girls, if the breast development is not seen until 13 years, please understand, the breast development not seen until 13 years, or menarche has not started until 15 years. So these are two things that we need to take the adolescent girl again to a pediatrician or a pediatric endocrinologist. So this is about the timing of puberty. So otherwise, we already talked about the secondary sexual characters which happen. And the parents also need to know that every child, whether it is a girl or a boy, is unique. So we cannot compare. For example, if another child or a girl of the same age has attained menarche, we cannot tell that this girl hasn't attained. And we shouldn't be using these like she hasn't come of age and things like that, because that will create psychosocial problems in that adolescent. And also in the class, when many girls have attained menarche and this girl is she's around 13 years and not attained menarche, this can create some psychosocial problems, and body image problems can also happen. So the parents should be very supportive and see that the child is growing normally and the breast development, everything's normal. If they have a doubt, they can take them to a pediatrician.
Thank you so much, ma'am. Like we already mentioned, you have already spoken about menstrupedia. I think it is one very, I would like to just share my own experience about this. My own daughters, before they were like around 9 years, had the first menstrual talk with them. I actually told them, I sat them down and explained to them. And before they were 11, actually, both of them hit puberty. So it was good preparation. They could actually accept puberty. Like when they got their first period, they could actually accept it very well. These books definitely helped me a lot. And for the boys, the book is Gulu. So the parents who are here, they can actually buy that book, or there are, like ma'am has already said, on the website menstrupedia.com, there are videos in all languages. You can all see. Anni చూడొచ్చు అది చాలా బాగుంది. Please sit with the children, explain to them the changes that can happen. Like girls లో ఛాతీ డెవలప్మెంట్ వస్తుంది, hair will be there, underarms in the private parts, ఇవన్నీ మనం చెప్తూ ఉండాలి repeated గా, so that they don't feel something has happened to them. They accept puberty easily. Ma'am, going on further, ma'am, role of the function of the pituitary gland in puberty. Could you highlight that?
Yeah, so pituitary is a small gland which is in the base of the brain. It is a very minute gland, but it produces certain hormones which are very important for growth and puberty. So starting from the FSH, LH, growth hormone, all these. The growth hormone is important for the growth spurt in both the boys and girls. And the FSH, LH, which we call the pubertal hormones, they start the pubertal process in both the boys and the girls. And this testosterone is secreted in the testicles in the boys. And in girls, the ovary secretes the estrogen and the progesterone, which is responsible for all the secondary sexual characters. So there are some problems that can happen in the pituitary, like an infection or a tumor, that can cause a precocious puberty, as we saw before, that puberty below less than 8 years,
8 years.
or it can be late, like after 14 years also. So these problems are evaluated by a pediatric endocrinologist. So a scan or certain blood tests and tests to be done and then evaluated.
Okay, thank you so much, ma'am. Just to summarize, I would like to say, if the child has not attained, if the girl has not seen, there is no breast development till 13 years of age, or the child has not experienced menarche by 15 years of age, it is better to see the pediatric endocrinologist, a pediatrician or a pediatric endocrinologist. And in boys also, if they are there's no change as such, the voice change, or there is no increase in testicular volume, better to meet the pediatric endocrinologist. Let us have a look at the social and emotional development, ma'am.
Yeah.
Would you like to throw some light on it before we
Yeah.
the changes that happen here, the identity crisis that they develop here?
So like adolescent, we said it's divided into early, middle, and late. In the early adolescence, like 10 to 13 years, mostly the children are like not at, I mean, not a child anymore, but they're stepping into a new world wherein they are experiencing some changes in their physical growth and the starting of puberty, which shows some secondary sexual characters. So they are in a state of confusion, and they are dealing with a lot of challenges because their brain, as we already saw, the brain is also undergoing changes, which leads to the state of role versus confusion. And in the middle adolescence, that is the 14 to 17 years, they're trying to set an identity of their own. So at this stage, if you see, like if a parent talks anything to the child, so mostly they try to backtalk. So they want to, they don't want to answer in a straight tone. They ask questions again. They also ask like, why are you telling me like this? I thought, they have a different perspective to anything that is said by the parent. So this is because in this stage is the period where the adolescent is undergoing a sense of like self identity. So parents at this stage should encourage the child to ask questions and also listen to them. A very important attitude of a parent during this stage should be active listening. Like just talking to the adolescent, like always advising them, if you keep, don't do this, don't do that, if you go out, come again. So if you keep doing this, then they won't listen to you. But active listening, asking them to talk, asking leading questions like, what do you feel about it? For example, you go for a movie. If you go for a movie with an adolescent, and it is a different type of movie, or some violence or sexual violence or things like that, instead of telling him like this is this, like that, you can ask the adolescent, what do you think about the movie? So that is a leading question, so that they might talk in detail. So we can do this active listening, and allowing them to talk and express their views will create more mental stability, and they will deal with this confusion and challenges. And they may also have various questions regarding religion and things like that. So we shouldn't be judgmental. For example, if a adolescent doesn't want to come to a temple, so we needn't be judgmental and cornering him and things like that. We can give him some time, because he is exploring his own perspective of what is life, and who am I, what am I here, what am I to do, so things like that. So we have to give him some time. And in the late stages, which is like 17, 18, 19, they would have formed some like abstract thinking, and they were uh, coming to the stage of decision making, a proper decision making, and deciding between what is right and what is wrong, and what they need to do in life. And they would have stabilized during this late adolescence. So until this stage, the parent should give some time to the adolescent, and always do the process of active listening, allow them to speak and connect with them. So take every opportunity that you can to connect with your adolescent. So instead of doing it in an advising tone, you can pick some topic of their interest. For example, if it's a boy, if he likes some sport, you can just take him to a football match or a cricket match and connect with them, and find out what they really want to do in life, because they're already in a state of confusion. So we can give them time and guide them to do if they want to do a particular course, or what they want to become in life, give them choices, and ask them to do the problem solving themselves. We can just be a guide. We shouldn't allow them, or we shouldn't tell them do this, do that. So we can ask them to do themselves, and we can guide them. So that is the approach that the parent should take
Yeah.
during the adolescent period.
Okay, nicely said, madam. So the self-identity is forming, and how the parents are supposed to connect to the child, understanding their various emotions and giving them a clarity on how to do it, how to proceed further, what courses they want to select, because this is again a very important age where they have to build their careers, choose their careers wisely. So and I really liked it, either watching a movie or going to a place where they like, it could be a cricket or a football match that they're interested in, so that they open up depending on the atmosphere around them. Ma'am, we all know that definitely they have friends during this age whom they feel are more important than the family at times. So what is the like peer relationship and influence on the pubertal minds?
Yeah, so this peer influence is a very important thing during the adolescent period. In the early adolescence, they are a bit attached to the parents, and try to tell everything they do in school, and they come home and share with their parents. But when they start entering this middle adolescence, that is when the parent realizes that the adolescent is moving far away from them, and they try to catch hold of that adolescent. So that is why a constant tussle or a conflict is there between the parent and the adolescent. So the approach that a parent should take during this stage is it's very important to know the friend circle of your adolescent boy or girl. It's very important. You can tell them or ask them to bring the friends home, connect with them, and see not only the physical friends like who they meet in school, the virtual friends or the social media friends which your adolescent has is a very important. It's not that the parent should become a friend of the adolescent on social media and try to stalk him or her and doing whatever, like following him. That is not what I am advising. But what the adolescent does in social media is also very important. So knowing the friend circle of your adolescent and the social media etiquette, what we call, because nowadays many adolescents they become members of this Insta, Snapchat in a very young age, and they uh, give the small age and just join these groups and have a lot of virtual friends. And recently we had this series on Netflix, the Adolescence series,
Yes, ma'am.
which talked the importance of this virtual social media behavior and how it affected adolescent boys' mind. So these are all very scary things that are happening recently in the this Gen Z. So every parent should be aware of what their adolescent boy or girl is doing in the virtual world, that is the social media, whatever things they are a member of. So there are some things that the parents can follow, like they can ask them, like have an open talk with them and asking their opinion. Like for example, if they're posting something on a very political or something, they can have a conversation. As I already said, active listening, asking them opinion and asking them how they feel about this issue. So these are certain things that may develop their perspective also, and giving them giving importance to their opinions or trusts or mistrusts, whatever they have, and trying to solve their confusion or doubts which they have in their mind is one approach that the parent can follow. Just to make sure the peer group in the virtual world and their adolescent is very safe in the because we are seeing a lot of issues related to these, and also things like cyberbullying, and these are all things that are happening regularly in the school. Also we have bullying cases. So we have to have an open chat with the adolescent. So whenever an opportunity arises, connect with them. And we can do this by what we call the emotional coaching. So whenever an adolescent comes back from school, he's angry or he's upset or feeling low, so the parent can take this an opportunity, try to connect with them and ask them to name their emotions, like what they felt that day, what was the reason for that emotion, and what could have been done to prevent that behavior. So these are all some basic steps of what we call the emotional coaching. So every parent can start this. For example, if an adolescent is coming angry back from school and throwing an outburst, so immediately if the parent also starts advising, or he himself gets angry and shouts at the adolescent, then things won't change. Instead, trying to connect with him and doing this emotional coaching will help a lot in preventing such future behaviors in the adolescent.
Thank you so much, ma'am. Like trust-based parenting is what you would suggest, because where the parents actually develop a trust over the child, then they are able to connect better with the child. And a couple of decades back, the parents had to take care of the physical friends. Like you rightly said, now there are virtual friends also. We need to address those also. What is happening over the internet? What was being shown in, let's say, like these web series and movies, where adolescent girls unknowingly they are sending their photographs to and they're getting caught in all this cybercrime. So
Yeah.
that is also another thing which where we have to save the children from. Very true, rightly said, ma'am. Going up, could you highlight some ways to cope up with the stress in adolescence?
Yeah. So, stress is something like each one of us, not only adolescent, the parents of adolescents have more stress. I think the parents here who have joined would agree with this. So, whenever the child enters the adolescent phase, the parents, and at the same time, the parents also will be in middle age. So the women will be almost nearing the menopause, and the men will be struggling with their career and things like that. So they themselves are stressed out. At the same time, the adolescents are also facing challenging situations in school, peer group pressure, and so many other issues, these social media issues. So when both the parties are in constant stress, so this leads to conflicts easily. And that is the reason there is always a conflict between the parent and the adolescent. So for a parent to approach the adolescent, the first thing I would advise is to self-care, to adopt this process of self-care. So every parent should take care of their own physical health, mental health, and take care of their stress first before approaching an adolescent. So just to give an example, if a father comes back from office, if he's very stressed out or angry, and in the same mood, if he goes and approaches his adolescent boy or girl, then that will create again conflicts, and major problems may arise. So a parent, first of all, should clear their stress and take care of themselves, give enough time, take some me time, especially the mothers who are always like homemakers, always the back of the children. So they need some me time. They can go out with friends and things like that. So parents' self-care is very important in parenting an adolescent. Coming to the adolescent, adolescents nowadays face stress from many angles. So at family, at home, uh, there is always a conflict between the parents. So naturally, they have stress. And when they go to school, they feel good with friends. And again, sometimes because of the peer pressure, they face stress and studies and coaching, sports, so many issues they face. They are always under stress. So we need to teach them to approach the stress in a proper way. So stress can be eustress or distress. We also have positive stress. For example, if an adolescent is good in sports or some passion, or what hobbies he follows, like art, drawing, or things like that, when he does that, and if he goes to a competition, that stress he has is called the eustress. So that is good. That is good to have a eustress. But at the same time, if it becomes very unimaginable, then it becomes a distress. So there is a difference in stress also for an adolescent. So if the adolescent is stressful, we need to make him resilient. Resilience is the art of making the adolescent approach the day-to-day challenges that he faces in life and making him more resilient. We can teach them simple life skills like self-esteem, decision making, problem solving, involving them and giving them responsibilities, and allowing them to make decisions on their own by giving some solutions. So these are some things that the parents can approach. And even in schools, we do these life skill workshops for the adolescent students, which helps them approach the challenges that they face with a positive mindset. And if they have stress, or like they're too stressed out or having depression, anxiety, so we can divert them and involve them to do things that they love, or their passion. For example, sports, distracting them to engage in sports and physical activity. We tell that physical activity 1 hour daily is very important for the adolescents. So these sort of activities will help them come out of the stress and give a good focus, not only the mind body focus, and also improves the focus in the studies. We can also ask them to engage in some other activities they like art, music. There are so many things that they can follow. And even yoga, meditation are things that they can follow to handle stress. And mindfulness. Mindfulness is one thing that I wanted to stress upon for the adolescents. Mindfulness is nothing but living in the present moment. For example, if we are in this meeting, we are talking to each other, interacting, just focusing on what we do now is called mindfulness. So we should allow the adolescents to practice this mindfulness starting from simple day-to-day activities. So they shouldn't be allowed to think of the past or worry about what happened in the last week. He had a he fought with his close friend, there was a breakup. So all those things they should forget. And they should also not worry about the future, like next week my exams are coming, so what will I do, I haven't studied. So forgetting all these, concentrating in the present, on today, today what is going to happen, today what is my plan, what I am going to do from morning to evening. So setting a timetable and asking them to do time management and things like this. So this is called mindfulness. So teaching them mindfulness will help or go a long way in handling stress in future situations. And also we can give them they can itself choose like how they can handle stress. I have seen many adolescents during counseling, they say, okay, I try to do this, I try to breathe in, breathe out. So they're so smart enough and very intelligent that they themselves uh, they devise certain practices that they can follow to prevent stress. So just helping them and guiding them in handling stress would be very helpful.
Right, ma'am. Like one thing is listening to the adolescents, having a conversation, like you already said, and helping them by practicing yoga, meditation. That is also one way of letting go of stress. And next is living in the moment, mindfulness. What happens, what I see most of the adolescents these days, including my own kids, something is which is going to be there the next week or next month. They are more worried about that. What is going to happen? How is it going to happen? Are we prepared for that? Usually these are the questions that keep coming up. They don't want to live what is happening now. They're watching a movie, their thoughts could be somewhere else. They're going for a function or they're going on a holiday, but still some exam that is there later on or something they have planned with their friends, that is more disturbing for them. They don't want to live in the moment. We have to keep telling them again and again, forget what is there, but enjoy the moment now. You have reading, read. If you are listening to music, listen. You go holidaying, holiday. We have to tell that. I think that is very important for them to
Exactly, Ramya. They
understand.
don't even have this eye contact while talking. So they're
Really
always
true.
thinking about something and looking into their mobile or
While
so they're not in the present. They're always thinking about
think
something.
about something very true, madam, because I have seen my own kids, my like
Yeah.
their friends actually. I used to think, is it only with my kids? But then, once I met their friends, and then once I started going to schools, like initially it was more of like preschool, because once we are a pediatrician, the same concept, like my Himobindam, I'm already told in the beginning, they will usually ask us to come talk about growth and development, nutrition in small kids. But once I started doing adolescent talks and other things, then I realized it's not just my kids. Most kids these days are like that. Very few of them who are actually living in the moment. And
And
with
even
the
with when they are with friends, when they are in a group, each friend is looking into their own gadget. They don't even talk with their
that's what they're chatting with somebody else who is not there. Like you already
very
mentioned about the
difficult to
virtual
deal
friend.
actually.
Virtual friends, very true, madam. They are in the gadget. Actually, they think this gadget is like a boon and a bane. It is definitely because we want them to be safe. We give them the phone so that we know where they are, their whereabouts. But then they have made up their own world inside that phone. They don't want to come out of it. That is what is happening. My daughter actually disconnected from the phone for about 5 to 6 months during her 10th exams. After that, after she completed the exams, I asked her, what are the positive changes that you have seen once you didn't use? She has actually listed out. She said, my concentration improved, my focus is better. I felt I'm able to write more. So all those things happen. She has herself realized the positive changes that are there once they don't give a lot of screen time. They're not going into much of screen time. But again, after exam, it's difficult, I guess, to control them, to
That's a
keep them
wonderful
off the
thing to
gadget.
do, Ramya. The
Ma'am,
digital detox, like it's for
digital
us
detox.
also, for adults
True.
also, sometimes it becomes too overwhelming.
Very
So
true.
we just need to just shut off the phone and
I think that is a whole lecture in itself, Madam
yeah,
Radhika.
correct,
We'll
correct.
have this one. Just to wrap up, we'll have a few things on the hygiene part of it. Could you enlighten us on the hygiene, ma'am, before we complete the talk for today?
Okay, so hygiene, like adolescents, like we have two extremes. Like we have one set of adolescents like who may have even take bath like 3, 4 times a day, and they're like a bit obsessive and cleaning and things like that. There are another set who are very idle and they don't want to even take care, don't even bath and things like that. And because of these hormonal changes that we were talking about in the adolescence, there are many issues that can happen like acne, skin changes, the skin may become oily, and they have this odor. the bad odor that can arise due to the sweating. And the sweating also is a bit more during the adolescent period. So these are certain things that we need to take care. So taking bath twice a day and wearing loose cotton clothes and taking care of the private area, private hygiene is also very important, especially for girls when they are menstruating. They be take care of what napkins they're using, and keeping it dry. So whenever they go to the restroom and come back, they should keep the private area dry, and they shouldn't wear tight underwear or like synthetic materials. So these are certain things that the girls should undergo, and boys also, they need to take care of their own hygiene, the general hygiene and the private hygiene. So sometimes boys may be having some things like nocturnal emissions and ejaculation. So these things that they can discuss with their father and some trusted adult, and see to it that what can be done. And they should also have they shouldn't have that fear or that guilt feeling because these things happen. So these things we can talk with the boys. And taking care of the skin, the adolescents are always concerned about their skin and hair because they want to look good. uh, Taking care of their beauty and the way they look is what they care most than the other things. So even a small thing like an acne or a little bit of hair fall can affect them more than a exam result. So these things also we need to take care. For a proper skin and hair, diet is also very important, and sleep. I think we missed sleep during this discussion.
Yeah.
Sleep is a very important thing during the adolescent period. Like 8 hours of sleep per day is very important for a adolescent, not only for the proper physical growth, but also for the mental focus, concentration in studies and academics, and for many other things. Sleep is very important.
Nicely said, madam. At the same time, could you tell us like a little more on the importance of sleep? 8 hours of sleep is very important, and how is it going to actually help the teenager?
Okay, so actually in the adolescent period, the normal circadian rhythm that we have, like in the children, if for example, 8, 9-year-old children goes to sleep daily by 10 p.m. in the night and gets up by 6 a.m. is a normal circadian rhythm. But in the adolescent period, this rhythm takes a 1 hour delay. For example, they go to sleep only by 11 or 12, and again they need to get up early in the morning to go to the school or some coaching classes or sports activities. So they have what is called the sleep debt. So every day this sleep debt adds up. Every day it adds up like 1 hour, 2 hours. So this chronic sleep debt may give rise to problems in learning and academics. They have issues in memorization, concentration, focus. So finally, they may have a fall in the academic performance, school performance, or what we call. And again, the usage of gadgets in the night time, especially before going to sleep, using these gadgets may also interfere with the sleep, and all these things can add on and cause problems. And this sleep debt not only affects the academics but also affects the immunity of the child. So may he is more prone to get infection. So that is how important sleep is.
Thank you, ma'am. Nicely said. One last thing, could you also highlight about the reproductive health, madam, how they are supposed to take care of the like you told about keeping the private areas clean, wearing loose cotton clothes. Other than that, what else can they do for their reproductive health?
Okay, so nowadays, like it's time we talk to the adolescent boys and girls about sexuality. So gone are the days when we used to, sex was a taboo and we weren't used to use these words in schools. But nowadays things are changing, and it's high time that we need to talk about these things to the adolescents. The parents can also take an opportunity to talk to the adolescents according to the appropriate age. For example, for a 12-year-old, 13-year-old, like talking about menstruation and what are the changes that takes place would help. But like after like 14, 15, middle and late adolescence, a talk about a pregnancy, reproduction, and issues like infections in the genital area is also very important. And when we go to schools, like for doing programs, many a time when we say that when you start menstruating, there is a chance of a pregnancy. So that that itself makes like they start giggling and they can't understand the concept. So this is very important because we are seeing teenage pregnancies. Though the latest family health survey says that teenage pregnancy has come down, we are still having like children, even like 14, 15-year-olds getting pregnant. And these girls have to know that when they start menstruating, there is a chance of pregnancy. Because many of the time they engage in some risky or in the name of romance, and they engage in relationships, and they get pregnant without even knowing, and finally they end up like only knowing at the 7, 8 months of pregnancy. And this is a big problem. Teenage pregnancy is a big problem. And we also have the POXO Act, which deals with these cases. And nowadays we have this consensual relationship between an adolescent boy and a girl. So these are the things that we need to talk to them, and we should tell them that delayed gratification is what we need to talk to them, like early sexual initiation or experimentation or indulging in risky sexual practices is can be risky to them and to the whole family and for the social structure as well. So we need to talk to them about safe sexual practices and delayed gratification and taking care of the genital area and preventing infection and even contraception. So times have come like we have to talk to the adolescent girls and the boys about contraception.
Yes, ma'am, very nicely said. We have to talk to them about sex, contraception, that is very important. At this juncture, I would like to make mention of a movie that was released recently, Telugu movie by named Court.
Yeah,
You watched it?
I just heard about it yesterday. I
Uh,
made to watch it. Yeah,
you
to
should
watch it.
watch it, madam. It's a
Yeah,
nice movie, which is like shows it shows how POXO can be misused also. So
correct.
what I would like to say is we have to be like we should have a little bit of knowledge. Young adults and adolescents should have knowledge of POXO also. There the girl is like a 17.5-year-old girl and the boy is 19 who are like uh, probably having feelings for each other, but how they get involved in the case. So this can be misused. They have to be alert and also have the knowledge of it. That is very important. Like you said, I usually like while watching movies or even advertisements, I take it as an opportunity to educate my kids. Well, this usually I felt they also like it better. It is like an open-ended question, just a conversation that we are having. So, what do you think? How could this have been prevented? And my girls came up with answers like maybe she shouldn't have made the call or she should have confided in her parents. So
Yeah.
I felt really happy, like the way they are thinking. Okay, we are on the right track. We are parenting them well enough. That is what is important. Just these small questions will actually help. I usually take this opportunity whenever there are movies or some talk shows that are going on, which I can watch with the kids. So what is their opinion? And they feel like they matter a lot. Once we ask them their opinion, what do they think on the subject, they feel that okay, our opinion matters. So maybe we have to think, and they actually think in the direction it makes us wonder. Like, it's really a beautiful period. Adolescence is a beautiful
Yeah,
period. We should
exactly,
all
Ramya.
be adolescents, is what most AHM members tell. We be
So
living
if they
in the
understand that we are giving importance to their opinion, they feel so good. Their
true.
self-esteem improves and
Yes.
they develop the trust in us. So as you
True.
rightly said, we should grab every opportunity. So just watching a movie, asking them, so grab every opportunity and connect with the child.
Right, ma'am. Ma'am, there are some questions from the chat box. Shall we take them?
Yeah.
Just a moment.
Or anyone wants to unmute and ask also, like, or wants to interact or any share their experiences.
Yes, ma'am. This is one question where, like, till what age we can wait for a voice change
Voice
in
change.
boys?
Okay, so in boys, like we can wait up to 14 years. So 14 years is the age when we wait for the changes to happen. So if it doesn't happen up to 14 years, then we need to evaluate. For girls, it's
14.
13 years. Yeah.
Yes,
For
so
boys, it's 14.
can wait up to 14 years. Okay. I think now we can take how much to talk about sex with an adolescent and how to initiate the conversation.
Yeah, that's
Yeah.
actually a good question.
Yes.
And like I can answer that question by simply telling, but every parent has to have their own experience and they have to learn. So parenting in itself is learning every day. So every day we experience something, we develop ourselves as a parent. For example, sex related questions, just starting as Dr. Ramya said, when we're watching a movie or in the middle of the movie, if there is an ad on a napkin or things like that, we can use that as an opportunity and ask the child. And also, it should be age appropriate. We have to give that age appropriate information to the child. For example, it's 11-year-old, 12-year-old, and asking about what is napkin. So instead of just shooing away, don't ask about all this is taboo. Instead of doing that, we can tell them that this is something that is used to, which helps in the during the period of menstruation and giving them small facts about menstruation. At the same time, as Dr. Ramya said, so watching a movie like Court with an adolescent, late adolescent, so that is a very good opportunity. We can connect with them and ask them, what do you think about this? Or even if you just see about suicide in the media, a very sensational case or something like that, we can ask the adolescent. Like how Ramya did, there was this sensational case in that Kolkata, that medical college, the doctor who was raped. So I was asking like, my daughter also, see how they have done, how, what do you feel about it? So just starting this conversation in whatever way, giving that opportunity and asking their opinion. How do they feel? Correcting them if needed.
exam for your further studies.
Pratiksha Mittal, could you please mute yourself? Pratiksha, could you please mute yourself? Uh, the host can do it actually. Pratiksha, I'm not able to mute them, madam, actually.
Okay, okay, fine.
Yeah, please, you can carry on.
So that's what we have to be. It should be age appropriate information. And we needn't just start the topic. Come, let's talk about sex. It's not like that. We can just create certain opportunities. And for example, if we go to a relative house where there is a delivery has happened, a small baby, we're going to see the baby, and the adolescent boy or a girl may ask, "How has this child come?" and things like that. So those times, like we can just make them understand in the form of pictures or small examples. So how this happens now, the baby comes and things like that. It should be age appropriate information in a simple language.
Nice, ma'am. Just if it would help the person who asked, Amulya, I think has asked this question, I will share my own experience of how I started the conversation with my own child. The elder one, she was about 15. And I had a case that day in the hospital where a 17-year-old girl came with pregnancy, which she had already pointed out, teenage pregnancy. Unfortunately, the girl didn't have any sex education. She didn't know that sex can result in a pregnancy. So this has happened. And then the day evening after I came home, I just asked my daughter, I explained the scenario to her. And I asked her, how do you think the girl got pregnant? And I was really happy when she said unprotected sex.
No.
Oh, and then we had the conversation further. So just wanted to know if she knows of the word. Definitely, it is taught in books in school, and like it is there in the media and other things. But once the word comes from them, it becomes easy for us to talk about it and make them feel comfortable about it. I think that would help. The next question, how to do correct parenting when as a parent we feel irritated by a 11, 12-year-old boy not listening and has very casual behavior. A very common scenario
Yeah,
we
yeah.
see.
Very common, which we
And
face day in, day out.
way out. And I would say there is
Every parent faces this. For such situations, I would like to tell a simple thing. For every parent who is having an adolescent boy or a girl and facing conflicts daily, I just ask them or advise them to pick your battles. Simple. You have to pick your battles. For example, if the boy has gone out without telling and he has made some a punky haircut of some recent movie star and he has come back. So naturally, the parent will feel angry. But for just think for a moment, it is just a haircut. Okay, so instead of making a big problem about that haircut and creating a big struggle like a war-like situation in the house, I think we can pick our battles. At the same time, if something has happened, like he has taken a two-wheeler from his without telling and without wearing a helmet, he's gone out and he's got injured and he's come back. So this is one situation where we need to intervene. So that is what I wanted to stress. You have to pick your battles. So leave alone the small things that may irritate you. For example, your girl may put in some makeup or do something. She can go out and come. So these are small things that you can ignore, but you have to give importance to the major ones, like how what I said before. Because if you keep getting into a conflict for all the small things, the adolescent will lose the trust in you. Then they will begin to hide facts and do without informing. So that becomes a trust breach of trust. So that is why I tell there are some issues that we need to intervene. We need to focus, but the smaller things can be ignored. So you have to pick your battles with the adolescent.
Nice, ma'am. Very aptly said. There's a continuation, I guess. How to motivate a boy continuously facing failure in performance, like sports, a sport that he likes.
Okay. So, we need to find out what the problem or where the problem lies, or will he need more coaching or training in some aspects, and we can bring back his focus, or is he having any other distraction or issues like nutrition or other issues? So we have to rule out all the medical and other causes and then try to find out where the issue lies, and then we need to focus on it. And resilience, nowadays
Resilience.
our children always they need whatever, I mean, whatever they aspire for, they need it immediately, and they can never take a no for anything. So we have to make them understand that accepting a failure is also important, so we cannot be always be successful. So sport is something that it can be a success or a failure. It's two
Failure.
sides of a coin. So they need to, we have to make them understand that accepting failure is also important. But keep
Okay.
trying and encouraging them and supporting them and guiding them to keep trying, but also allowing them not to get depressed because of this failure, to accept failure.
To accept failure, to learn from the failure, and like
Yes,
you said, to rule out any health concerns that are
issues.
there, any
Yes.
micronutrient deficiencies or macronutrient deficiencies that the child is not able to, because of which he's not able to perform well. Is it affecting the performance? We have to address that. Right, ma'am. How to address the issue of abusive language which they pick from school? Very common scenario.
So this is one again common thing that we come across. Abusive language is not only picked from school. Yeah, it is. The major part comes from the friends and the peer group, but it is also influenced by media and also people at home.
True.
So everything starts from home. So we are the role models for our adolescents. So we might have accidentally spoken to our spouse or some relative in a harsh tone, or even some like we would have made some work call over the phone and just shouted the person on the opposite side using some abusive language. And this would have been picked up by the adolescent. So we are all role models. So we need to act uh, like very in a positive way when the adolescent is watching us. And again, if he is using his abusive language, this is again a time to connect with the adolescent and make him understand that this will not help him in any way in improving himself or in growing up as a successful adult. So we need to make him understand that it would be wrong to do this on his part, and where from he picked up this language, and trying to find out the peer group. Or so it could be some older boys who use this language and try to bully him. So there are so many issues that can happen. So we need to find out from where the language comes in and try to address the issue. At the same time, parents also have to be like very careful when they're talking in front of adolescents.
Yes, my parents as role models and actually telling the child that why it is not correct to use the abusive language. They might hear it somewhere, but it is better to just forget it, ignore it, than rather than using it again, than the child
So
repeating it. That is important. We should, that is what, like, rather than knowing where the child has picked up from, it is better to teach the child that it should not be used and the consequences of using such a language. If the child understands, I think they will get over the issue.
exactly. So recently, I counseled a 12-year-old adolescent girl with some issues. And when opening up to me, she told that because of her behavior, her parent, her mother, used the F word. And she was very upset and she told me that she used this. So this is where it all starts. So
True.
we might use it in a fit of rage, like,
Rage.
so that they take it forward. So we need
Exactly,
to be
ma'am.
very careful.
And you also mentioned one more thing that the parents have to be careful. The one thing, but one child whom I was counseling, she asked me if I shout at my mother, my mom says it's wrong, but is it okay if my mom shouts at her mom? I was actually amazed at what the child was thinking.
Yes.
Like she didn't like her mother did not like the child yelling, but the child is observing. That is very important.
Correct,
We have to
correct.
realize that the children are observing us.
We
So
think that they
we,
don't
yeah,
observe, but they are very
very,
smart.
very smart. True.
They can
This
use
is
it against us whenever needed.
how to deal with adolescent anemia, boys and girls, and its impact on the quality of physical life and mental level.
Yeah, this is a wonderful question. So actually, anemia is a big topic, and the recent surveys tell that around 50% of our adolescent girls are anemic, and a smaller percentage, like around 30 to 35% boys are anemic.
Anemic.
We all should know that because of the rapid growth that we were talking about all this time, the rapid height and weight changes that takes place, adolescents are more prone for anemia. And also because of the erratic food habits, and especially in girls due to the added effect of menstruation, the monthly bleeding, all these add on to the problem of anemia in the adolescents. Like this anemia, it can be used as a screening test when going to a pediatrician's office for a regular visit or a vaccine visit. If you find or if you have doubt that the child might be anemic, we can do a blood test and find it out. If we have found that the adolescent is anemic, we can treat them with iron supplementation. And taking the iron supplementation will for 3 months will correct that anemia. And later on, how to prevent the anemia would be based on a proper balanced diet, that already what we talked about. And iron is one of the major micronutrients which is essential for the prevention of anemia. So we have to make them include it in their regular diet. For example, greens, we have jaggery, dates, and if you're eating non-vegetarian food source is a better source of iron because the absorption is more than the vegetarian source. But the vegetarian sources also, if taken in a proper thing, can prevent anemia. And this anemia, it not only affects the physical growth and development. So the question is very clever and smart question. So he's asked, like, how does it affect the mental health?
Mental health.
Yes, it affects the mental health. So studies have found out that anemia has an impact on the cognitive behavior of the child, and also in the academic performance in things like memory, concentration. So there is a cognitive decline, like slowly, like when there is a continuous anemia. So they may not perform well in school and they may become tired. They may not do well in sports or other extracurricular activities also. So anemia, whenever founded, need to be corrected because it not only affects the physical but also the mental health.
And like we recently had, madam, IAP says at least 13 is what we are recommending for both boys and girls, a level, HP level of 13. And ma'am has already physical and mental effects of anemia, where the performance decreases, the child is not able to walk maybe a certain distance which the child was able to walk previously. Their concentration in the class comes down. It can also manifest with, for the girls, like hair fall issues will be there. So these pointers, if you are able to pick up early, maybe we can correct the anemia and help the children better. Most of the times they come with very low hemoglobins, very late presentation. We have to go for transfusions and things like that. I think that's the last question. So we can hear from the Sneha ma'am, Himabindu Singh ma'am, Prakash sir.
Yeah. Actually, I would like to acknowledge the presence of Dr. Sharja Puljale madam from Chhattisgarh.
Ma'am.
Madam Sharja ji, thank you for joining. And also, as Bhaskar has joined, our president of PATS, Dr. Bhaskar. Dr.
Bhaskar sir, we welcome sir.
It was a very useful program, particularly for the parents taking care of their grown-up children. Really, I found it very useful and interesting.
Thank you, Dr. Bhaskar. This is AHA Telangana along with IAP Telangana doing it. And I'm really appreciate personally Dr. Ramya, who's from our Karimnagar. And she's now, I will looking forward for your more active participation, Ramya. And Dr. Lakshmi Shanthi, both of you on blue today. And really, it was such a nice conversation. It was like heart to heart between it was not looking like a formal thing, but very informal, very touchy. And it was all the questions were also, most of the parents would like to, I mean, that is the common questions, what normal, most of the questions parents will have in their mind. Nicely answered. It was very nice interaction, very, very useful. I think we request Dr. Ramya and Dr. Telangana, IAP and AHA to conduct more such parenting sessions. And we should, all this can go on the website of IAP, AHA. So request Ramya to give us a recording and we will be posting on the website. So that will be useful to others. Yeah.
Sure.
Thank you. Thank you. Thank you, Dr. Bhaskar, for joining. We all came from Rajahmundry, from Central Zone, Pedicon. There was all the 5 states they were having their annual conference, Central Zone conference there. So thank you for joining, Dr. Bhaskar. So this is from my side, Dr. Ramya. Over to you.
Thank you, ma'am. Thank you so much. Anybody else who would like to talk?
We have a senior pediatrician from Tamil Nadu, ma'am, Dr. Parimala.
Ma'am, we welcome you, ma'am. Please give us your input.
Parimala, ma'am. I think she's
she's from which place, Lakshmi?
Tamil Nadu, ma'am. She's also an adolescent.
Yeah, nice. So which place in Tamil Nadu?
Trichy, ma'am. Trichy.
Trichy. Thank you, Dr. Parimala, madam, who has joined from Trichy. So
we have PR Rajendra sir, who's joined from Karimnagar, ma'am. Sir, your comments or
yeah, please. Rajendra garu, thank you for joining. Ilak sessions inka ekku cheyal manu. So please let us know your inputs if you're there. Yeah, I think next time, because most of them are traveling, Dr.
the Central Zone conference right now.
So you should see that they're all present, yeah?
Yes, okay. Yes. Thank you, ma'am.
Thank you.
Thank you so much, Lakshmi ma'am. It was like a truly learning session. And all the enthusiastic audience who have asked wonderful doubts and queries. I hope we were able to answer most of them.
Yeah, thank you so much. Thank you, Hima ma'am.
Thank you, Lakshmi.
Just to close off, before closing off, the last line of that quote, I just wanted to, most importantly, after all the conflicts between the parent and the teens, it is important to remember, while all this is going on, that you and your child are always on the same side. So that is one thing every parent has to remember. Whatever conflict is going on, we should always take the side of the child. We shouldn't be judgmental. Thank you.
Unconditional love and support.
Yes.
And you should love and enjoy parenting. And nothing is perfect. Every day we learn. Yeah.
Ma'am,
very nice.
Ma'am is here.
Oh,
Good evening, madam. Hima, madam.
Yeah, good evening.
Yeah, a very nice, excellent session, madam. Really, very helpful. All questions are very nice. I would like to ask one question to madam. Just recent గా మా brother వాళ్ళ son abroad లో ఉన్నాడు మేడం. అయితే because of peer groups, he's asking వాళ్ళిద్దరు ఫ్రెండ్స్ multiple apps download చేసుకున్నారు. So mom, I want to like install so many apps. He had something almost 2-3 apps also there. ఇంకా స్టిల్ నాకు ఇంకొక 2-3 apps యాడ్ చేసుకుందాం అనుకుంటున్నాను అని he stopped taking food and with some disturbed sleep. 1 week he like little bit disturbed. So recently she asked this question to me, madam. So inputs from you all, madam. You all experts. Ramya, very nice lecture, Ramya. Very
Thank you, ma'am.
nice interactive session. Yeah.
Lakshmi, did you take
Yeah.
that?
So actually,
Yes.
so the
It is
child,
about
the child is always into the mobile and doesn't.
no,
It's
no. I will
affecting
just
his daily
explain.
life, like eating and sleeping.
Yeah.
Am I
No,
right? Yeah.
no,
Okay.
no, madam. She said that the child wants to install few more apps
Yeah.
for which the parents are not permitting, and because of which the child has stopped eating, and definitely the sleep has also affected.
Oh, okay,
Yeah.
okay. So it looks like a problematic internet use, the continuous use of internet, and that is affecting his behavior. And what is the age of the child, ma'am?
13 years, madam. 13 years.
Oh,
It's
13.
early adolescence, almost
Correct,
end of
correct.
early adolescence.
Correct. So I think a proper like consultation with an adolescent pediatrician if possible, because we need to make
Sure.
a full assessment of the child, the HEADS assessment, what we do starting from the home and all the other factors to see if there are some other factors that are influencing this behavior. And finally, as parents, we can help the child by distracting him from that media or screen time by doing some other thing like engaging them in sports or some other things that they like, and keep a watch on them, like screen time, how many hours a
Yes.
day they are using. And we can
Yes.
allow the adolescent itself to make rules, because if parents tell, they're rebellious, they don't want to listen. So we can ask them to make rules, like how many hours a day you want to watch. For example, the acceptable thing is 2 hours. So how do you want to use it? If it is academic or non-academic, so you make a rule by yourself and see to it that you follow, so that they'll also feel more responsible if they make the rule themselves and they don't want to break away from the rule. And supporting them and guiding them and involving them in other, distracting them from the screen time use will help, so that this aggressive behavior won't repeat.
I think here it was a case of Alagadam. Alagadam అంటారు కదా.
Yes, madam.
Yeah.
Yes,
So,
ma'am.
So he was
from my part, yes, madam, you are right. అలగడం లాగానే ఉండే.
అదే
అయితే నేను from my
కామన్ అది she said, అది స్కోప్ వాళ్ళనే ఇవ్వనమాట. ఇట్లా ఇవన్నీ ఉన్నాయి, 2 hours ఎట్లా స్పెండ్ చేసి వాళ్ళకే కొంచెం ఇన్వాల్వ్ చేసి you should make them party to the decision making or rules in the house. So that's the best way, so that you will get their cooperation. And if there are then distractions and giving them other, you also should be with them and enjoy other things like sports and all. And so that there are other things in life, not only this. వాళ్ళకి ఇంప్రెషన్ ఉండాలి. అండ్ కొంచెం అదిగా అది అలగడమే
yes sir, మీరు అన్నట్టు మీరు మేడం, మీరు జస్ట్ నౌ టోల్డ్ సేమ్. నేను వాట్ మై సైడ్, ఫ్రమ్ మై సైడ్ ఐ టోల్డ్ దెమ్ లైక్ ఓకే, యు ఆస్క్ జస్ట్ మెరిట్స్ అండ్ డిమెరిట్స్ ఆఫ్ దట్ యాప్. నువ్వు కూర్చొని అడుగు వాడి అడ్వాంటేజెస్, ఆ యాప్ తో వాడికి ఎంత ప్లెజర్ వస్తుంది. సో మేడం చెప్పినట్టు ఆ ప్లెజర్ నీకు అదర్ స్పోర్ట్స్ లో కూడా వస్తుందేమో. సో అదర్ చేసి నువ్వు కూడా అదర్ వాటిలో ఉంటే కనుక, సో మేబీ హీ విల్ చేంజ్, యూ ట్రై అని చెప్పాను. సో డెఫినెట్లీ దీస్ ఇన్పుట్స్ విల్ హెల్ప్ టు యూ, టు మై ఐ విల్ షేర్ టు మై niece, madam, definitely. Yeah, thank you so much.
Madam, friends వాళ్ళు యాప్స్ పెట్టుంటే వాళ్ళకి సేమ్ వాళ్ళకి
Yes, exactly, madam, peer pressure. you don't know about this app. What is this? You don't know
Correct.
about this app. Yeah, you're like me. You're afraid with your mom. What is this? So like that. Like it's
Correct.
abroad. They're living in Dallas. So like yeah. Thank you, madam. Thank you so much for your inputs. Definitely, I will share to my niece.
Yeah.
Thank you.
Thank
Thank
you,
you.
madam. Thank you.
Thank you.
Thank
Ma'am,
you.
shall
Yeah.
we wrap up, ma'am?
Yes, Ramya. Very good
Ma'am.
again, once again.
Ma'am,
Congratulations to you and Dr. Lakshmi Shanthi and
thank you. Thank you
IAP
for the
Telangana
opportunity.
and AHA Telangana. Thank you. Yeah.
Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you.
Sneha ji is there. No, I think Sneha was there. Treasurer and Arya sir from Central
Sneha ma'am
AHA.
was there, ma'am. Actually, I asked
Ah.
for her input. I think she left.
She left.
Just
Dr.
checking.
Arya
Yeah, she
also. I
left.
think.
Yeah,
Okay.
sir also left.
शारजा मैडम अभी हैं कि नहीं आप?
हूँ मैडम।
अरे मैडम
Hmm.
बात तो कीजिए, वीडियो ऑन कीजिए, आपको बहुत दिन हो गया आपको देख के।
Namaste, ma'am.
हाँ, मैं पूरा
Madam is a
दिन
very
आपको
senior
दो बार
professor from Chhattisgarh Raipur Medical College, and she was an active member of the Women's Pediatricians Forum from Chhattisgarh. She has moved the whole Chhattisgarh, and now she's a very respected person there. Yeah, madam,
Thank
आपके
you,
inputs.
ma'am. It is a very good talk and arranged by Ramaya. It is very good.
Thank
Very
you.
good discussion on adolescent. Very good discussion and important points are discussed here. Thank you. Thank you,
Thank
madam.
you. Thank you so much, ma'am. Thank you for your inputs.
Thank you, madam.
Yeah, thank you, madam.
आप आओ आप छत्तीसगढ़ में,
हाँ
छत्तीसगढ़ आइए।
हाँ, अब आएंगे ना, अब रायपुर में आप रख रहे हैं वर्कशॉप, आपसे
हाँ
मिलेंगे।
जरूर, बिल्कुल रखिए।
ठीक है,
थैंक यू।
चलिए, थैंक यू, बाय बाय। Thank you, Lakshmi.
Thank you, ma'am.
Thank you, ma'am. Thank you.
Okay, ma'am. Thank you.
Excellent.
Thank you.
Yes, please.